I'm going to talk to you about feline atopic syndrome. And for many of you, this term might be new, and you might be referring to allergic skin disease or allergic disease in cats in many ways. And in the past, this was kind of a conflict because people would talk about atopy in cats or hypersensitivity in cats. So a few years ago, there was this publication, and you can use the QR code to have access to this open access publication, where you can read about the new classification of allergic disease in cats. And I think this is a great resource, and I would love to be able to cover everything, but we have a limited time, and we will focus on food allergies today in cats. But I think this is a great resource. And if you're able and you're focused on feline medicine, you should definitely take a look. So today we're going to talk about how do we approach cats that are manifesting allergic skin disease. And I want to go really down to, as a clinician, how we manage these clients. And many of you, if you're focused on feline medicine or you're doing general practice, you know that cat parents, cat owners, cat tutors, as we say here in LATAM, are really engaged with their cats. And many of them, they come into the consult being very worried, very concerned, very nervous. And I have changed the way I try to approach those clients because many of them require a bit more information. So once we do all of the initial part of the consultation, I will take time and really go over this beautiful chart that is part of the publication that I showed you before. And this great chart, I really like it because it explains how feline atopic syndrome is really an umbrella for allergic cat disease. And you will have gastrointestinal manifestations, you will have skin manifestations, and respiratory manifestations. Obviously, as dermatologists, we tend not to focus on respiratory problems, but within the consult, we do want to ask questions regarding any problems that they're having regarding wheezing or coughing or sneezing, because we are not seeing just the skin of the cat. We're trying to do really a holistic approach when we're trying to approach clients and in a very integral manner. So I really like this chart, and people love it when we explain this to them. And if you see in red, and we'll emphasize more on this, flea-related allergy is not a part of feline atopic syndrome. It's really separate, but it will cause the same symptoms. So you have to consider it there, understanding it, that it will cause the same skin manifestations. Okay, so the definition of feline atopic skin syndrome is this inflammatory and pruritic disease in cats that will show in different typical patterns that are usually caused by allergic disease, but they can be caused and triggered by many other things. So when we are working these cases, we have to consider other diagnostic possibilities because the skin in cats tends to manifest in these typical 4 patterns that are sometimes easy to recognize, but the cause can be different. And to make things even more complicated, food allergies and flea allergies can cause the same skin manifestation. So that's even more complicated. So throughout the presentation, I will mention this a few times. In feline medicine in general, but particularly in allergic feline disease, there's a very limited amount of studies and publications available. And a lot of the information that we try to present as facts, and I think that in general in veterinary medicine that tends to be a problem. Many of the studies are either very small, they have some flaws, and follow-up with cats, if you've ever tried to do a study in cats, is quite challenging. So doing good, large studies in cats can be very difficult. So bear this in mind that a lot of the numbers that we present when we're talking about statistics in cats, they do have a caveat where we are not really talking about a really large population, and it might not be always significant. So please keep that in mind. Okay, so let's focus on feline food allergy. And feline food allergy will be any clinical manifestation. This can be the skin or non-dermatological, like gastrointestinal or other things that can happen that are related to an immunological response to mostly environmental triggers. But again, food can be a causative reason for these types of manifestations. So, this is really the thing that we face when we're trying to diagnose cats. And feline atopic skin syndrome and food allergy clinically look exactly the same. And what this means as a clinician is that we need to approach these cases really working them really carefully, because we just don't want to start thinking about allergies and having these tunnel visions from the very beginning. Always think, okay, this can be allergic disease, this can be food allergy, these can be environmental allergies, and we have to start from there. And where do we always start? And you've heard every single dermatologist when it's talking about how to approach cases, we go into a very careful clinical history. And in particularly in cats, it depends where you are practicing, because we have a wide audience here from the world, and some people work with veterinary technicians and wonderful nurses that can help us in our clinical process. But I like to do clinical histories with my feline patients because I get a feel for the owners, I get a feel about what the situation is with that cat, and this part, I think, engaging with the client from the beginning is really important. I want to learn about their lifestyle. Obviously, I want to know if there's more animals in the house, if there's people visiting with other animals, because this will be relevant eventually. We always want to have a clear view of what medications have been used and what effect those medications had. We try to use a format before they start in the consult, and we sit them down before they come in and they fill out paperwork thinking about previous treatments, because I'm sure all of you have faced when they come in and they said, oh, I gave them this pink pill, or I gave them this yellow liquid, and we don't know what they're using. So if they have time to work with that information before coming into the consultation room, we'll streamline things and make them much better. So then we have to ask about itching, about pruritus. And itching is in cats. Again, they're cats, they're more difficult, and for owners, having a clear idea of what itching is in cats, it's not really clear. So I love this visual scale of itchiness in cats because it's cat specific. If you have ever asked a cat owner client about itchiness using the PIVA score in dogs, they're going to be confused because the focus is pruritic behavior, and leaking is part of the pruritic behavior. So if you can, this is readily available online, like the first chart that I showed you. If you have any screen in your consult room, which I'm sure you have because you have a computer, you can pull up this itching chart specifically for cats, and this will be very helpful. And you can also translate it in whatever language you use, because this is very, very helpful. Okay, from then, we go to gastrointestinal history. So remember, if somebody's coming in because they have a cat with skin disease, this cat is itchy, this cat has lesions, they're not really thinking about GI disease. So if we don't ask specific questions about diarrhea, about gas, about problems with foods in the past, they might not remember to bring it up. So we have to ask about GI problems and GI presentations. Again, we want to ask about what they're feeding their cats, and that's kind of an obvious question. We tend to ask what are they feeding now, but we want to know what they have been feeding in the past. And we'll talk more about feeding and food in this lecture. Okay, and finally, I want to also ask about seasonality. And this is a difficult question for cat owners. Sometimes you will have a very savvy cat parent that will be able to identify and say, yes, I've seen this happen only in the winter or only in the summer, but it requires a very observant cat owner to observe and mention this. If you are able to use a fecal scoring chart, this is very helpful. Some people are put off by them and they don't like them, but this is really useful to understand if we are having any fecal consistency problems. And you can see the QR code because you can have access to that chart, or you can ask for maybe a representative to give you a physical chart. You can print it and you can have it in your consultation room to use with your clients. This is another touchy subject because we find that most cat owners who have indoor cats will refuse to give flea prevention because they believe that their cats never have fleas, they're clean, they're beautiful. It's impossible that they're going to have fleas, but that is not the truth. The reality, if you can see, that is a catio or a patio for cats. In their minds, that is an indoor cat. Obviously, that is not an indoor cat, that is an outdoor cat. But this similar situation can happen when the cat has access to a private garden. They believe that their garden is not the outside, or maybe we have outside visitors with animals that bring in the possibility of fleas. Maybe they're getting groomed outside. They're going somewhere commercial to have grooming. So there's so many possibilities to be exposed to fleas that this is a critical spot where you don't want to start with allergic diagnosis before you rule out ectoparasites. And I will emphasize this later, but this is critically important. So let's talk about the clinical presentations of food allergy. We will see some patients that have GI disturbances such as vomiting and diarrhea, which are the most common one. You can see weight loss. You can have gas and salivation in lesser amounts of patients, but you have to keep your eye out for all of these because they will not be necessarily mentioned in the clinical history if you don't take the time to do so. So this is an older classification of allergies or hypersensitivity in cats. And you can see the patterns between flea allergies and food allergies and environmental allergies. They all look the same as the mirror I showed you before. So it's very difficult to clinically distinguish all of these presentations. And you can't see a cat, and because of their anatomical presentation, think, oh, this is for sure food allergies, or this is for sure environmental. They all look exactly the same. So what do we see on patients that have food allergy? You will see these common cutaneous reaction patterns, such as miliary dermatitis. The most common is self-induced alopecia, but this is also the same case with environmental allergies, head and neck pruritus. You can see the eosinophilic granuloma complex, and other less common presentations such as urticaria, non-pruritic cutaneous nodules, plasma pododermatitis, and do not forget ears, because in dogs, otitis are very common as part of allergic disease, but in cats, it's a lesser percentage, but it is present. So when you're doing a physical exam in a cat, you have to look at the ears. And sometimes I find that because of the way that cats can behave in a consultation, even though we've gotten much better at managing cats, and we use sprays and we use music and we use lighting, but sometimes we don't have the ability to manage a cat properly. Look at the ears, open the mouth, and look carefully at all of the cat because we want to find anything and everything that's going on with those patients. And finally, but not least, all of these patients tend to be pruritic. They are itchy. So this is some clinical pictures, miliary dermatitis, and I really want to just emphasize how important it is to look for miliary dermatitis, because it can present with alopecia, but it can also present without alopecia. So you have to go through the coat of the cat and find those little pustules or papules in the skin, erythema, and sometimes these lesions will be exacerbated by pruritic behavior, and usually pruritus is present, but not always. Self-induced alopecia is the most common presentation, and this is a very common cause of visit in a veterinary clinic. Owners will come in concern because their cats are losing part of their fur. They have alopecia, usually is symmetric, usually has certain patterns that we can recognize, but sometimes cats do weird things, and we'll see like half of the cat having an alopecic lesion, and we tend again to have these very tunnel vision idea of, okay, I'm sure this is a self-induced alopecia. Don't go there, because sometimes ectoparasites can cause this, so you have to keep in mind that you have to work up these cases. Many of these cats can present having repeated hair balls, vomiting, having feces with hairs, and if an owner notices them, we do have to pay attention to this. Last thing about self-induced alopecia. This used to be called psychogenic alopecia. And I still see many patients that come in being diagnosed for a long time as having a behavior problem. And there is a small study, again, this is only 21 cats that have self-induced alopecia, and they were carefully worked up and examined, and only 2 out of 21 had a behavioral component. So we have to take account of the possibility of behavior playing a role, but most commonly there's going to be other causes, mostly allergies in these patients. So a few images. This is very typical. You will see alopecia many times in the abdominal region. Careful. I know that there's a lot of cat clinicians here and probably in the audience out there, and we want to make sure that we don't have urinary infections. We want to make sure that these cats don't have any orthopedic problems that can cause over-grooming. So take a look at these patients entirely and don't focus only on the alopecic lesions. If you look closely at the close-up, there is hair present. The hair is still growing, so the cat is barbing the hair or licking the hair with a tongue and removing the hair. Other presentation, this cat has more regions affecting, having the front legs and the back and the abdominal region more and more extended. And this causes great distress to the owners. One would think that because the skin has no lesions, then maybe it's not so important. But it is important. And these cats have distress, they're not feeling well, so we have to treat these patients and diagnose them properly. This is a frequent client of mine. Now she's doing really well, but she likes to groom that specific back region, very linear lesion. And I did mention, normally we don't see lesions in the skin, but lesions can be present and they can be very complicated and exacerbate. So if you ask the owners, is this cat itchy? Some owners will say, oh, definitely, I see them going to that region and over-grooming or scratching, but some owners won't be able to tell us what's going on. So one option, we can do a trichogram. We can take some hairs and go to the microscope, and we will see breakage of that hair, and that can help us with a diagnosis. This is healthy hair that's just broken. In the past, it was recommended to use cones to see if the hair would regrow. I don't think anybody here would think it's a good idea to put a cone in a cat just to see if the hair regrows, so not very recommendable. So let's move on to head and neck pruritus, and this is a really difficult presentation. These cats really suffer. This is a patient I saw a few months ago where this cat is really kind of locked in there. It has a rigid neck with a cone, so it's not damaging itself because it's causing a lot of harm. Most of these patients need physical restraint to prevent them from harming themselves, and they will need medications to control the itch. Some of these patients are really, really hard to manage and will need multiple techniques to deal with the pruritus in them. I call them gatos tacos, or cat that are taco cats, because normally they're like, they have a lot of clothing and they're restrained, and when we see them come in, we know what's going on with them, and usually it's very sad because they're very uncomfortable. So a few images of the harm they tend to do. As I mentioned, this is the face and the neck region. It can be in the back of the ears. Be careful to look for ear disease because this can be pruritic and it can mimic the same problem. Finally, eosinophilic granuloma complex, and boy, it can be complex. It can affect various regions in the body. Some of these lesions can be pruritic, and the patterns are fairly easy to differentiate if you're familiar with them, where you will see eosinophilic granuloma. As you can see, you can find the chin, and you can find mouth lesions. You can find the indolent ulcer, which is very striking. Usually it starts on one side and then it increases inside. And if it gets infected, it can become painful and very pruritic. So it is really important to do cytology in all these lesions. And sometimes you will see things like this. This is a cat that we saw probably last year and had this awful interdigital lesion. And when we did cytology, you can see how striking the eosinophils are in this cytology, but you can also see a ton of bacteria. You can see cocci, you can see rods that are contributing to the itch. So this cat was really going in for that lesion. That's why it's so damaged. And eventually this cat was diagnosed with food allergies and managed. It did relapse once, but it's really important to take a look at these patients and identify all contributing factors. So all of these bunch of differential diagnoses are important to keep in mind. I do want to emphasize Malassezia and Staphylococcus infections as contributing, not necessarily primary factors, but if you don't do cytology and you skip cytology, you will miss seeing these secondary infections that do contribute to itchy cats. And I think that we have this very clear with dogs, but not necessarily with cats. Finally, and not least, and I mentioned it before, and I will mention it again, we want these cats to be on flea prevention. I like to use isoxazolines because of the range of effectiveness. And there's some, besides fleas, there's some other pruritic ectoparasites, like the Modex gattoi, which it's not very common, but can be contagious, can be very pruritic, and it can mimic all of these presentations that we mentioned before. So let's go into food allergies. We still need a diet trial. We can't run away from a diet trial. That is still the gold standard. We can argue about diet duration. Generally, as in dogs, I try to keep diet trials as short as possible because they're very difficult to do correctly. So my goal is to do 6 weeks. Sometimes we'll go longer, but many times we'll go shorter. And we want to have communication with the owner and understand what's going on with their cats. There are common allergens, and again, I'll refer to the limited literature that we have, where beef, fish, and chicken are the most common food allergens in cats. But this is based on very little information. So I'm sure that there is a regional differences based on geography. And finally, and I do know that this can be a contentious issue, testing available for diagnosing food allergy has not been validated in cats. And there are different options available in the market out there, but there's not one serious large studies for food allergy testing that's been done. This can change in the future, but for now, we're kind of stuck with diet trials to be able to diagnose these cats. So, okay, we're doing a diet trial. You do have to do symptom management. You just can't give a new food to the cat and expect the symptoms to go away and the owner to go away happily with that instruction. So we want to be able to control itch. Some cats will be okay with a physical barrier. I know that my colleagues in LATAM are very familiar with these types of bodies, not necessarily in other regions, but these bodies are very useful because they prevent physical harm and they're not so uncomfortable. Most cats will not like them when you put them on, but after a little while, they tend to be okay with them. We do use some topical therapy. Many of you know that topical therapy in cats is very challenging because they will eat everything, they will lick everything. So we have to do it in moderation, we have to do it with safe products, but sometimes topical steroids, when the lesions are very focal, can be useful. So this can be an alternative. We tend to rely on systemic medications such as steroids and glucocorticoids, which act very fast. They're very effective, usually, not always, but sometimes we can't use them. Maybe the cat would have a comorbidity. They could be diabetic. They could have Cushing's. They could have another indication not to use steroids. So we will have that limitation, and we'll have to decide if we want to use oclacitinib, which is an off-label medication in cats and should be used carefully and informed and should be monitored. It's never a first line of treatment in cats using oclacitinib, and really I want to put that out there. And secondary infections, I mentioned them before, don't overlook them. If you don't treat those secondary infections, maybe the diet trial is working, but these cats will continue to be uncomfortable and itchy. Diet trials are really difficult to do and to do well. So for that, we need to do many considerations. We need to see if we have a multi-cat home. Is it even possible to do a strict diet? Is the cat very picky? Is the owner particular about the diet recommendation? What type of lifestyle does the cat have? Does it have access to other foods or to hunting? In certain circumstances, we cannot recommend a diet trial because of the living conditions, and you have to be able to identify those cats in order not to waste time, because it's not worth recommending a specific diet trial if it's not going to work. So what can you do if you're facing challenges? You can try to feed separately, but this is very stressful for most cats. So if you put them in a separate area or a separate room, or maybe you do time feeding, sometimes this can work, but for many cats, this will not be an option. These electronic feeders are individual, so the cat will have an electronic tag, and when they come near the food will open up. So if you don't have too many cats, each cat can have their separate feeder, and they can feed throughout the day. Remember, we cannot starve a cat. It's not like with dogs that we say, don't worry, he'll eat the food. If we don't starve cats, they'll get sick. So this is not an approach we like to use. We want to be able to communicate with the owner and make sure that the cat is being able to eat the diet. So what's the best diet? We want the cats to doing that, really to enjoy the diet and the owner to enjoy the diet. But please identify patients that are not good candidates for diet trial. Sometimes we'll just have to skip this phase and move on to environmental allergies or to symptom management. So I want to take a little opportunity here to talk about why talking about nutrition is so important in the consultation room. Owners are coming in to us as experts, and sometimes we skip this part because it's kind of tough talking about diets today. So what I do nowadays, and I've changed the way I do it, I have tools during the consultation. For example, this is a dermatology consult, but this is a cat that is overweight. And I want to be able to approach this in a positive way, look for an opportunity to talk about the situation in the cat and find the right moment to do it, because sometimes owners are not ready to talk about their cat being overweight. We want to use visual guides such as this Wasaba's body score. I love this Center Square resource where you can use it for yourself. There's a QR code if you haven't visited before, and you can use a resource there such as the calorie calculator and some of the conversations that can help you guide through the nutritional conversations. So what diet should I use for a diet trial? Here, the feeding history may play a role where you want to maybe consider if the information that you received is important in terms of what types of food the cat received, and you want to consider food ideology. Because this is what we're facing today. We have lost our voice, and this has been given to influencers, to social media, and what can we do as clinicians to face this? And I change my strategy every day. This is not something I do the same every time. The first one is don't make them believe that they have to use a commercial diet. They might want to do a home-prepared diet, but we want to do it with an expert. We want to do it with a nutritionist. Second of all, and I draw my line there, I don't work with raw diets, and I love this resource. Please use the QR code. This is a wonderful publication that encompasses different studies from the risks associated with feeding raw diets to pets. Seek reliable information and have it ready. You can use resources such as Pet Foodology. You can use the Pet Nutrition Alliance. There's so much information, and you can have handouts to deliver if you don't have the time to deal with your clients. And also knowing when not to push. Maybe it's not the right time to make a change, and you need another consultation to make those changes. Again, this is a wonderful resource. I wish I could go through everything, and we are, I know, a little bit short on time. This will only deal with resources for you and your team to have better communications related to nutrition. So we don't have enough time. The owner might have ideas and fear about our recommendation, and we might lack the knowledge on nutrition. So if we work on those aspects, we can do a better job with these patients. So can we recommend home-prepared diets? Not the ones that are readily available online. There's a few studies that have proven that they're not complete and balanced, so we want to use a nutritionist. And if you are going to use a novel protein diet, you can do that, but the problem is that there's a lot of evidence regarding contamination and non-declared ingredient in those diets. And also using well-pet diets, the ones that are available over the counter, can have those problems. Finally, the possibility of cross-reactivity between proteins might be an issue. This has been proven in dogs, not necessarily in cats, and it's been shown to be a factor in humans. So careful with the diets when you're recommending a new protein and say, hey, just change to salmon or change to a different protein. Be careful what type of diet you're using because it might have other ingredients that are not shown in the label. What do we use? We try to use hydrolyzed diets. And I will tell you that most of our owners uptake hydrolyzed diets, and the reason that we like them is because the quality control is good. We know that there's not anything that is not in the label. The nutrition is complete and balanced. They're practical, they're available. They have great digestibility for cats that have GI problems. They are kind of limited because they don't have moist options, and that can be a problem in cats, and we don't have treats available. Talk with your clients on how to medicate cats because this can be a problem, and just show them how to do it. I think that sometimes we underestimate cat owners. They can learn how to medicate cats if we give them the resources. Take the time to explain to your owners how to do a diet trial and have good communication with them. So, okay, we've done the diet trial. When do we challenge and when do we stop? When the clinical signs are better, when we're off medications, and if gastrointestinal problems have been resolved. And at that point, we want to challenge with the old diet and see if the symptoms relapse. So what do we do if we have not solved the skin problem with the diet? We move on with environmental management. We can continue with systemic medications such as cyclosporine, which is normally the drug we use long-term. We can use topical therapy. We can use nutritional interventions because there's some studies that show that we can feed some nutrients that can help the skin, or we can go to alternative medications such as CBD, which I don't normally use, or other alternative medications when we don't have good responders. Finally, don't forget that immunotherapy for environmental allergies is a good option for some cats, and there's a newer study that shows it to be effective. So if you're dealing with environmental allergies, considering doing this, but this is once we have ruled out the rest. We never start with environmental testing. And with that, I am done. Thank you so much for your time.